Good morning. First, let's thank Dr. Julio Montana take leadership to organize this first treatment as a prevention workshop. Second, I would like to acknowledge and thank NIDA to support my participation of this important meeting. I'm going to present you HIV testing treatment as a prevention in China. This slide shows you annual reported HIV infection and AIDS cases. And you can notice that since 2004, each year we have identified about 40,000 to 60,000 of new HIV infections, and also more than 10,000 of AIDS cases. If we're looking at the testing rates by the population size, China is huge. We tested about 5% of total population last year. We have 4 provinces test more than 10% of the population. We have 8 provinces test population between 5 to 10. The rest are lower than 5% of total. We also scaled up ART treatment very quickly. In the past 5 years, we increased from less than 20,000 to over 100,000 of patients. However, we still face tremendous challenge. Each year, we added a new AIDS patient in the treatment program, increased by about 30% to 50%. That's good progress. However, look at the last row. If you look at the last row, the number of reported AIDS deaths continuing to increase. Why? The speed we aid for ART treatment is only accounted for about 50% of annual aided number of cases that need treatment. We are much slower than the HIV spread. We are much slower the HIV progress. The good news, we have new policy issued by end of last year. That's called simply 5 expansions, 6 strengthening. The 5 expansion include education to tackle stigma, testing, vigorous, large-scale testing, scaling up prevention mother-to-child transmission, scaling up prevention intervention among high-risk group, scaling up ART. The strengthening is to provide support for the 5 expansion that including blood safety, medical service, care support, protect human rights for people infected, affected. Government take leadership for overall response for HIV/AIDS, and also increase personal capacity. This is a weather report about Beijing. Like the weather report, we have all the previous data. We can predict the temperature and everything, even by the time. Last October, I visited Dr. Julio, his center, talk about testing and treatment. We think about how can we do that in China? Can we use the weather report or weather forecast can predict how many people we can be identified in each year, how many people being targeted for the treatment aided. What we try to do, we use the previous data, use a linear model or log-linear model to predict how many new infection can we identify in the 2011 or in each of next year. Let me give you an example. For example, we take Guangxi province as an example. This is a previous year, how many newly HIV infection identified. This column shows you how many of patients who first time test HIV already in the later stage of AIDS. Then we have total new infection in this column. If we base the linear model, we have about 12,400 people we should have been identified in this year. If we look at linear model, we have 11,700 been tested. locate how many people are in the later stage, then we get this number as a target for Guangxi to be identified in this year. Similarly, we did example for Henan province. So we give this number to Henan province. We did this for each of province. We set up the goal for this year, 70,000 of newly identified HIV cases. That is 16% increase compared with last year. So by the end of this year, we'll hold each of province accountable to see how they achieved the target. If they achieve a target, we give them national award. If they do not achieve a target, we may reduce budget for next year. Similarly, we use weather broadcast to predict how many people in ART needed to be added this year. So we set up 40,000. That is 37% increase compared with last year. What challenge we faced? We set up the treatment criteria. Any HIV-infected people below 350 should be eligible for treatment. However, for patients below 200, only 80% in the treatment. And for patients between 200 and 350, only 30% in the treatment. That is not acceptable. So this year, we set this target. And also for patients between 350 and 500, even over 500, should be in the treatment for discordant couple. The two big challenges we faced: doctors are willing to provide treatment for patients between 200 and 350. Even patients themselves are reluctant to take treatment. That's the two major challenge. We need a trained doctor, we need to educate patients. Thank you very much.